Hello, everyone. I am Dr. Ritu Hinduja. Thank you for logging in today to hear me talk on recurrent pregnancy loss. I'm a senior consultant IVF or reproductive medicine specialist with No.1 IVF Andheri, Mumbai. I'm also a senior executive committee member in the Indian Society of Assisted Reproduction. And today I am here to talk to you about a topic which is more often than not ignored, and this topic is recurrent pregnancy loss. I decided to speak to you all about recurrent pregnancy loss because October is a month of creating awareness about infant and pregnancy loss. So, what better topic could have I taken to bring about awareness on this very sensitive? And I'm here to answer any queries or questions that you may have about this particular subject topic. So, before I start talking about what is recurrent pregnancy loss and how do we go about in cases of recurrent pregnancy loss, I generally start all my talks or counselings by explaining to people how normal conception takes place, because unless you understand how normal conception takes place, it is very difficult for me to build on as to what is going wrong, what can go wrong, what do we investigate, and how do we manage it. So very simple is this diagram that I usually always draw. Okay. So you have to understand that in every menstrual cycle, when a woman menstruates, she ovulates or releases an egg either from the right ovary or the left ovary. Okay. So one of them. The egg then goes and waits in the fallopian tubes. And when you get intimate, the sperm travels from here. The egg and the sperm meet in the fallopian tube. The embryo is created here. Then the embryo goes and implants itself in the uterus, the endometrium, and that is where the baby goes from 9 months and how the pregnancy progresses. So if you've understood this, you have understood what do we need massively for a good pregnancy to take place and for the pregnancy to continue forward is a healthy embryo, that is egg plus sperm, that is the embryo. So if you have to understand, it is the seed and the soil theory, seed being the embryo, soil being the endometrium or the mother, the womb. Okay, so every time a pregnancy loss takes place, it's either the egg, that is the embryo, or the endometrium, which we, or the maternal factors, which we need to kind of investigate and treat. Now, recurrent, why do we call it recurrent pregnancy loss? We call it recurrent pregnancy loss because if it has happened with a same woman, that she has lost her pregnancy before 20 weeks of pregnancy two times consecutively, that is known as recurrent pregnancy loss. Okay. And once that happens, we have to start investigating and we have to start doing some tests and we need to start offering some kind of treatment. Now, I've explained to you the seed and the soil theory. So, what do we investigate on? We investigate on the embryo, that's the seed, and we investigate on the uterus, the endometrium, or the maternal factors, that would be the soil. Okay. Now, investigating on the embryo would be first and foremost, we need to know what kind of embryo quality was there. So what do we test for in the embryo quality? If the couple is willing and we have explained to them all the repercussions of having another pregnancy loss, we can advise advanced tests like pre-implantation genetic testing, where we do an IVF cycle, we create the embryos, we take a biopsy of the embryos, and we send it for testing. Once we have the report of these embryos that have been created in an IVF cycle, we transfer only the normal embryos, because you have to understand that when a conception is trying to take place, the nature takes care of itself and makes sure that the abnormal embryos don't implant. So, or if it implants, it doesn't get carried forward. So, we have to make sure that if a woman has suffered these recurrent pregnancy loss, next time when we do an embryo transfer or we try to make her pregnant, we make sure that the embryo is absolutely normal and we are inserting a normal embryo inside the woman. Okay. So you have to understand that we've tested the embryo. Okay, so that's one thing that we can do. The second thing we can do is we can also do something for the sperms, because the embryo is a mixture of the egg and the sperm, right? So we cannot do much with the eggs, but yes, we can do something with the sperms. Now, if the sperms are available and they're good in number, that is, if they are more than 5 million in number, then we can do something which is known as magnetic assortment of sperms. Now, what happens in magnetic assortment of sperms is that sperms with high DNA fragmentation, that means sperms which are fragmented at different places in their body, that means they've got breaks in their membrane. They are not highly potential sperms. So we kind of make sure that these less potential sperms get stuck to a magnetic column, and the more potential sperms are collected through the magnetic column, and we use that for the purpose of inseminating the eggs during an IVF process. And we use those embryos that are created from these sperms, and we do the transfer, and that has also given us very good results. So we've spoken about this seed part of it. Now comes to the soil part of it. Okay, so what all can we investigate in a woman when it is a recurrent pregnancy loss? So first and foremost, the uterus. Uh, a good ultrasound, a three-dimensional ultrasound needs to be done to investigate if there is any fibroids or polyps. Fibroids are basically kind of benign tumors which are there in the uterus or the uterine cavity. And polyps are also they are a part of the endometrium. So endometrium is basically, if this is the uterus, endometrium is these three lines. Okay, so endometrium is something that kind of regenerates every menstrual cycle and is shed every menstrual cycle. So if there is a protrusion in the endometrium which is actually sitting, here or here or somewhere, we can manage it by a hysteroscopy. So if we diagnose a polyp, then we go inside via a hysteroscope, and we kind of remove the polyp and make sure that a woman is free of polyps. If it is fibroids in the uterus, fibroids again can be either in the uterine musculature here, or can be indenting inside the endometrial canal like this. So if they are fibroids, then also we can do a laparoscopy. We can take care of the fibroids and then ask the woman to conceive again. So we can do this in the maternal factors. We can make sure that these things are tested for. What other things can we test for is we can test for any autoimmune disorders in a woman, like antiphospholipid antibody, anticardiolipin antibody, etc. If she suffers from any other autoimmune diseases like systemic lupus erythematosus, or if someone knows about it, it's called SLE, or any other autoimmune disorders, is also tested in the woman. So these are basically things that can happen in treating for recurrent pregnancy losses. Now, why are we so concerned about recurrent pregnancy loss? Is because 15% of all diagnosed pregnancies, so all pregnancies which have been confirmed, 15% of them will land up in a loss, right? So imagine the kind of undiagnosed pregnancies which land up in a loss. So it is very important that there is awareness about pregnancy losses, that women are aware that these kind of things happen, so that if they've had two consecutive losses, they can actually come and seek treatment. One very important thing that we also do when a woman suffers from a recurrent pregnancy loss is we check the karyotype of the husband and wife also, because we need to be sure that nothing abnormal is being passed on from the parents to the embryo. And we make sure of that, so that there's nothing. So like I said, nature takes care of itself and makes sure that the abnormal embryos don't implant. So we have certain questions coming in. I'll start taking questions now. Lakshmi has asked, can anuploy cause recurrent pregnancy loss? So, like I said, that it is the seed in the soil theory. So, of course, a seed, that's the embryo being normal, is not the entire or the complete story. there can be other maternal factors that kind of affect the continuation of pregnancy, and can also, those factors can be responsible in a recurrent pregnancy loss. So yes, Lakshmi, a euploid embryo can also cause a recurrent pregnancy loss, whereas your question was aneuploid. So aneuploid means an abnormal embryo, right? So abnormal embryo, like I've explained, yes, an aneuploid embryo does cause pregnancy loss. So yes, so if there is a person who has had aneuploid embryos, or is suspecting that the embryo is aneuploid, then it's better to go ahead pre-genetic testing for aneuploidy. Make sure that your embryos don't have abnormal embryos, and transfer only the normal embryos. Preeti has asked what causes recurrent pregnancy loss. I think more or less I've answered your question. It can be an abnormal embryo. It can be, maternal factors like autoimmune disorders, any polyp, fibroids, etc., that are there in the uterus. It could be a septum on the fundus. So the septum is like, it kind of, it's like this, it comes down from here, is called a septum. So there could be a septum. You have to understand that uterus, or the uterine cavity, is a very small cavity. So there's no place, so there's just this much place in the uterine cavity, right? So the embryo, which is really really small, and I'm going to place it in a very very small cavity. So if there's anything there, like a septum or a polyp or any diversion, etc., that will hamper the implantation of the embryo. So the embryo will, if it gets implanted, will get displaced, and there can be a lot of problems that can happen. Also, sometimes women just have a half uterus, which is known as a unicornate uterus. So they just have like half a uterus, they don't have the entire uterus. So if a woman conceives with such a uterus also, because there isn't enough place for the embryo to grow and for the baby to grow, it can also lead to a pregnancy loss. Okay, so Vidya, what tests are done for couples with recurrent pregnancy loss? I think I've already explained that. So karyotyping for both husband and wife, any autoimmune disorders for the wife. You can do a hysteroscopy for the wife, a good 3D dimensional ultrasound for the wife's uterus. Again, sperm DNA fragmentation for the husband to know if he has more sperms which are not really very good, because there is breaks in the membrane of the sperms, for which we can again do max, like sorting it through the magnetic column. And like I said, pre-genetic testing for aneuploidy, where we create the embryos, send the biopsy of the embryos for testing. Once we get back the results, whether it is a normal embryo, an abnormal embryo, we transfer back only normal embryos. So that is like the gold standard test if a woman has undergone recurrent pregnancy loss. So what I usually like to do when I'm addressing a case like that is do pre-genetic testing for aneuploidy. So make sure that the embryos are normal, and also simultaneously investigate the woman completely, like make sure she doesn't have any fibroids, polyps, make sure she doesn't have any autoimmune disorders. And I also like to give an empirical low molecular weight heparin injection, which is a blood thinner. So I make sure that the blood is kind of reaching the embryo completely, and any other hidden autoimmune disorders which can't be diagnosed, etc., are taken care of with those injections. So usually low molecular weight heparin injection works beautifully with the pre-genetic testing for aneuploidy, provided there is no other factor that I've already mentioned is not there. Vidya says, what tests are done for couples with recurrent pregnancy loss has been answered. Rohit asks, what treatments are available for recurrent pregnancy loss? Like I've said, if there is an anatomical disturbance, like if there's a polyp or fibroid, we remove it. If there's a septum, we remove it. If we think that the uterine cavity is a little smaller, when we do a hysteroscopy that puts a scope inside the uterus and see the uterine cavity, then we kind of, broaden up the uterine cavity. It's called metroplasty. So we do that. Then we give blood thinners to the woman when she conceives. We also can do pre-genetic testing for aneuploidy that I have been emphasizing on again and again. And we can, while doing an IVF cycle, we can sort the sperms in a specific manner, which is known as magnetic assortment of sperms, to make sure that this doesn't happen. Trisha, do I need to keep any diet so the pregnancy loss as I'm trying from the last 4 years to get pregnant? Trisha, I do not understand your question. Are you trying to get pregnant and not being able to get pregnant, or are you getting pregnant and losing your pregnancy for the past 4 years? I'm sorry, but I'll answer this question to the best of my capability. Is that if you are trying to get pregnant for the last 4 years, whether it is being a recurrent loss or you not being able to conceive in itself, I think it is time to consult a reproduction specialist or a fertility specialist doctor. Because by guidelines, if your age is less than 30 years of age and you've been trying for more than 1 year, and if your age is more than 30 years of age and you've been trying for more than 6 months, then it's time that you need to seek help and you need to consult a fertility specialist. Ruchita says, this was my third miscarriage. What should I do, doctor? Please advise me. Richita, first and foremost, stay positive. I want to tell you that there are a lot of treatments available out there. If it is your third miss and you haven't already sought help from a fertility specialist, first and foremost, make a checklist, put it on the top of your priority list. You need to go see a fertility specialist, right? Um, like I've already explained to you, get yourself diagnosed, get your ultrasounds done, get your blood works done, make sure you and your husband have the karyotyping done, get a sperm DNA fragmentation test done for your husband's sperms, and also at the same time, discuss pre-implantation genetic testing for aneuploidy with your fertility consultant. So I think these are the steps that you need to take now further. You need to discuss low molecular weight heparin injections also with your doctor. I don't think that you should try to get pregnant a fourth time without seeking help. Get yourself investigated and keep faith. And I'm praying for you. So, and keep us updated. I hope. Okay. Mohan, do the sperm counts need to be checked? I think so. Need to do my checkup. It's been 8 years that my wife is now getting pregnant. Mr. Mohan, yes, like I have already said again in my talk, that if you are less than 30 years of age and you have been trying for more than a year, and if you're more than 30 years of age and you've been trying for more than 6 months to get pregnant and you have not been successful, then the husband and the wife both need to get investigated. You have to understand that infertility is not a solitary problem. It is not a problem of a wife or a husband. It is a couple's problem. And it is something that you both need to, kind of overcome together. So you both need to get investigated. You are ready to do your sperm analysis and semen analysis, and that's wonderful. But at the same time, simultaneously, you need to get your wife investigated as well. So you can't investigate just one member of the couple while we are, tackling a case of infertility. We need to investigate both the husband and the wife simultaneously to be able to, kind of help the couple to conceive. So, if there are any more questions that you would like to ask, I am here. I am available to answer these questions for you. Um, I believe I've already spoken most of it, and I hope this has really helped you out. I hope the concept is clear about how pregnancy gets conceived, and if it's getting lost, then what all do we look for? You all already have a checklist in with you all, and I especially wish Trisha all the very best for your next attempt, and I hope you do seek a good fertility specialist, and you do get pregnant, and you do have a very nice healthy baby, please. So I'm so glad that you all took part in this discussion actively, and I had so many questions about recurrent pregnancy loss, and I am glad that I could bring about some kind of awareness related to this topic. um, I believe if there aren't going to be any more questions, then we are going to be wrapping up this session soon. Um, I'll just wait for another like 2 seconds before I can end this live. Okay, I guess we're not getting any more questions. I hope you liked this live. And if you did, do let us know how you liked it. And yeah, thank you so much for being here with us. And stay tuned to Baby Chakra for a lot more lives with a lot more specialists. And I hope, and I know that Baby Chakra is going to keep you updated on a lot of other topics and create awareness. Thank you. Stay safe.